everyone. So for today's video, I'll be doing a random demonstration of ECG monitoring. First, we need to gather all the equipments that we're going to use, such as the ECG monitor, the electrodes, and also the alcohol and the cotton balls. Next, perform hand hygiene. Before I enter this room, I already wash my hands and perform hand hygiene and wear gloves. So we need to provide privacy to the clients to ensure their safety and be comfortable while doing the procedure. But we need to verify the client's identity and also explain to them of what are we going to do. So good morning, sir. I am Chel, your student nurse for today. So what is your name, sir? Okay. So the purpose of this ECG monitoring is to assess of any cardiac rhythm of your heart and also to see if there's any abnormalities of your electrical activity of your heart. And sir, you need to relax and feel free while doing the procedure. So you need to lay down the patient and also the head is elevated. And okay, so I'll be exposing your chest later, but did you use some cream or lotion, sir? Okay. But before we going to put the electrodes, we need to clean the chest of the patient, the alcohol, the cotton balls. So I'll be cleaning the part of the chest and also the hand, and the lower limb. So, but first we need to ask if the patient has accessories or any objects, because this may interfere if there's any accessories. This may interfere while doing the test. And so first we need to put the V1, but we're going to clean the chest, the part of the chest, dry one, also the dry one. So the V1 is the color red. So I'll be putting on this on the right external border, which is the which is my line mark is the sternum. This is the sternum. So I'll be putting this on the fourth intercostal space. So first, second, third, fourth. So this is the fourth intercostal space. And next is the V2 on the left external border of the chest, which is the color yellow. So the yellow one. So this is in the left intercostal space, or in the fourth intercostal space. So just beside the V1. And then next, we need to put the B4, which is the blue one. So this is the B4. And also the V3, just between the B2 and B4. Next is the B5, just the part of the anterior part of the axilla. So the B5, which is the color brown. Just beside the B4. And also the V6 in the mid-axilla lane, just beside of the B5. So next, we're going to move the limb lead placement. So first, we need to clean the part and the dry. So first is the right lower right forearm wrist, and then the left forearm wrist. So the first one is the color white. So this is so I'm going to put this on the right forearm wrist. Next is the black one. I'm going to put this on the left forearm wrist. And also the color green, which is the a green electrode in the lower leg proximal to the ankle. And which is the last is the color red, which is the left lower proximal to the ankle. So that is the lead placement of the ECG. But we need to start the ECG. So I'll be starting, sir. So sir, please don't move too much when I'm gonna start the ECG monitor, because moving can interfere the electrical activity of your heart. Okay. Okay, it's done already, sir. So we're going to clean again the part of the lead. So first we need to remove in the forearm wrist on the left. And also on the right. Next is in the left lower leg, proximal to the ankle. Next is in the right. So first we need to remove the V1. Is that okay with you, sir? Okay, just relax po. The V2. Also the V3. And the B4, also the B5, and the B6. So we need to remove and discard appropriately and wash hands to prevent any cross-contamination. So, sir, do you need anything before I'll go? And we need to turn off the ECG. And we need to, this is your, the purpose of indication of this ECG is because you're experiencing chest pain. And lastly, I will document all the findings. So the time of ECG and the presence of P waves and QRS are complexes that have no any association with each other due to the atria and ventricles functioning independently. Thank you.